Hello people, in this video let us look at a previous year question, that is PYQ, asked in the anatomy theory paper final exam of first year MBBS. So the question here is musculocutaneous nerve. This is the topic, musculocutaneous nerve. What and all are they asking? So they want you to tell the origin of this nerve, course, branches and termination of this nerve. Apart from that, one more question they're asking: why motor distribution of musculocutaneous nerve is affected in Erb's palsy? Okay, so they're talking about Erb's palsy, and the motor part of musculocutaneous nerve is affected, right? Motor means the muscle. The muscles supplied by this nerve seem to be affected by Erb's palsy. They want you to explain. Guys, focus on the marks also here. So neatly they have told you for what, how much marks they will give, right? So very nicely I'm seeing that they are saying that for the origin, right, they will give you half mark. For the course they'll give you 2 marks. For branches just 1 mark. For the termination they'll give you only half mark and 1 mark for why the motor distribution of musculocutaneous nerve is affected in Erb's palsy. So for 5 marks, every half mark they're telling you for what they will give. A very interesting question. So let's get started with the origin. Okay. Now, origin of musculocutaneous nerve. So first of all, where is musculocutaneous nerve? Suddenly, if you think, right, muscle, cutaneous, which nerve, which nerve is this, right? Exact location you will not realize, but it is an upper limb in your arm. Okay, so from shoulder to forearm it is supplying. Okay, so here here you have the brachial plexus. In the brachial plexus, in the lateral cord, you have the one of the lateral nerves that you see is the musculocutaneous nerve. This is equivalent to your sciatic nerve in your thigh. Touch your thigh, from your hip to your down, what goes? Sciatic nerve. That is why this is actually very important in the exam also. They are asking, why is it called like this? Why musculocutaneous nerve? Why sciatic nerve is called sciatic? So beautiful. But for musculocutaneous nerve, there's no nerve, there's no specific name. So it supplies the muscles and the skin, the lateral part of your forearm. Okay, so skin means what? Cutaneous, right? So here skin it is supplying. So musculocutaneous nerve. So where is musculocutaneous nerve? If somebody asks, suddenly you realize that it is in your upper limb, that is in your arm and forearm. Okay. So why is this nerve labeled like this? Because it supplies the muscles of the front of the arm. So anterior compartment of your arm it is supplying, and the skin of the lateral side of your forearm. So which they have marked here in green, you can see. Can you see this? This one. Now you understood musculocutaneous nerve where it is. But even half mark also you have not got, because for origin they will give you half mark. So the origin is from this C5, C6, C7 spinal nerves, cervical nerves, which are coming, that nothing but the spinal nerves. In this, they form this lateral cord, right? And the lateral cord, one of the branches you see of lateral cord here is the musculocutaneous nerve. So musculocutaneous nerve, the roots are from the ventral rami, that is the anterior part of the C5, C6, C7 segments of spinal cord. Okay, so posterior they have shown in brown here, so it is not posterior, remember it's anterior. So the ventral rami of C5, C6, C7 segments of spinal cord. Okay, and in the lateral cord you should see it's a branch of the lateral cord of the brachial plexus. Okay, like this you should see. Okay, so you have the musculocutaneous branch, C5, C6, C7 branch of the lateral cord of what? Of the brachial plexus. Very good. Next, so half mark you got. Next thing is course of this nerve. Okay, so where is the course that you're seeing here? The course, it is coming here, and it is in the arm. Where is it going? It seems to be going between all these muscles, right? And then it is going to the lateral part of your forearm. Okay, so that is the course. But let us see how to write it in the exam. Okay, here's what the textbook says. Course of musculocutaneous nerve, they have made it as axilla and arm. Let us say axilla and then the arm. Okay, so we will make it 3 parts, unlike the textbook. So in the axilla, it is where is it? It is a musculocutaneous nerve is a branch of the lateral cord of the brachial plexus. Everybody knows this. It lies lateral to the axillary artery and to the brachial artery. So this much you should understand. What do they mean by it lies lateral to the axillary artery and upper part of brachial artery. That means see if here in this diagram here you can see, right? So here you have the musculocutaneous nerve, right? So here you have the axillary artery, and then the same axillary artery is becoming brachial artery. So musculocutaneous nerve lies lateral to these two arteries, and it is actually the third part of the axillary artery, right? So if you divide it into three parts, the third part is where it is lying lateral to the axillary artery, then it is lying lateral to the brachial artery. Simple, right? I think this is kind of happening in the arm itself. So this, it lies lateral to the brachial artery. This one, I would like to put it in the arm. Musculocutaneous nerve lies lateral to brachial artery. How's this, guys? Do you like what I did? So axilla, we are putting about that it lies lateral to the axillary artery and it accompanies the third part of axillary artery. Coming to arm, the musculocutaneous nerve lies lateral to the upper part of brachial artery. Then it supplies three muscles. Remember which are all? Coracobrachialis. Then biceps brachii. This is the musculocutaneous nerve, right? So this is the musculo part. So, which are the three muscles? Coracobrachialis, biceps brachii and brachialis. So, you can see here coracobrachialis, and then between the biceps brachii and the brachialis, you have this nerve going. Can you see that nerve? Right. So, in the arm, it supplies coracobrachialis. It pierces the muscle to lie in the intermuscular septum between the brachialis and the biceps brachii. Okay, both are these muscles also supplied by musculocutaneous nerve. So which are the muscles supplied by musculocutaneous nerve? Coracobrachialis, right? And then it will lie between this biceps brachii and brachialis muscle, right? So this is what you have to know. This is the course also. So there is some transverse septum which separates the biceps from the brachialis, okay? And in that septum, this nerve will lie. So something you should remember, there is a septum between this bicep brachii and brachialis muscle. In that septum, this musculocutaneous nerve will be there. Okay, this much if you know, enough. Now coming to forearm. Let's come to forearm now. So what happens now? You need that photo, I think, to understand. At the crease of the elbow, it becomes cutaneous. Cutaneous means it comes towards the skin, and it will so basically it will pierce the deep fascia and come out cutaneous it will become, and this nerve is now called as lateral cutaneous nerve. This is nothing but the termination also of the nerve. So it terminates as lateral cutaneous nerve. Okay, so its a name changes. The nerve itself changing name. It is not a branch. Lateral cutaneous nerve is not a branch. Remember, it is the nerve itself changes name to lateral cutaneous nerve. So you understood this is the termination also of this nerve. So termination word you have to write for a half mark. Remember. So this word you will say the nerve is called lateral cutaneous nerve of forearm. This is nothing but the termination. Okay, but under termination, again in that heading, you will write this. Okay, now it will supply the skin of the lateral side of the forearm, both front and back, which they have shown in this diagram very beautifully. Front and back, lateral part of your forearm skin. Okay, so this is the course. Any question with any information about course you want? Not required, right? Okay, very good. So now let's go to the next section here. We have seen this. Okay, relation, if they ask you. I think in the question they have not asked relation, right? So in the course itself, we'll cover off the relation also, okay? Just important points. So it accompanies the axillary artery and all that we told you, the third part of axillary artery. What is there anteriorly? You have a muscle that is anterior to this in the axilla. I think in the axilla they are saying the relationship. In the axilla, the relationships anteriorly pectoralis major. Posteriorly, you have the subscapularis muscle. Medially, what do you have? Medially, you should not forget. You already know it. Axillary artery. And medially, you have the median nerve, which you can see here. Right? Where is median nerve? Here. This is musculocutaneous nerve. Medially, what do you have? Median nerve. all this is happening in the axilla, remember. We are not talking about a relationship elsewhere. We are talking about the relationship in the axilla. And laterally, you have the coracobrachialis. Okay. Now coming to the arm, so when it leaves the axilla, it enters the arm by piercing the coracobrachialis. So which muscle does it pierce? It pierces the coracobrachialis muscle, and then in the arm it runs downwards laterally between the biceps brachii and the brachialis. Same story we are repeating again. So it runs between these two muscles, and then it will reach the lateral side of the tendon of biceps. Obviously it is going lateral, you can see here, and then it is going where? It is going to pierce the deep fascia and come out as the cutaneous nerve, lateral cutaneous nerve in your forearm. Okay. See, the course had the maximum marks. 2 marks they had allotted for course. Okay. Then 1 mark for branches. Now let us look at branches. So branches, you have 4 headings here. Okay. Which are the headings? Let us look at the headings. Please just make some space for all this data that we are going to see now. So the headings are muscular, cutaneous, articular, and communicating. So 4 types of branches. Muscular branches. Don't worry, you already know this. In the front of the arm, it supplies coracobrachialis, biceps brachii, and brachialis muscle. 3 muscles only you have to remember, right? Already you know this. Now coming to cutaneous branch. Where does it supply? Lateral side of forearm, front and back. This also you already know. Very good. Did you know that there are articular branches? Yes, it will supply the joints which are near it. Which joint? It will supply mainly, you should remember. See, it starts off here at the shoulder joint. Mainly you should talk about the elbow joint. Okay. And then the superior radioulnar joint. That is nothing but the elbow joint, isn't it? So I'll rather put it there only. So mainly elbow joint is what they are focusing on. Shoulder joint also they have written little. So they just write some branches to these joints, that's enough. Communicating branches. Now what do you mean by communicating branches? See, this lateral cutaneous nerve is there, right? What it does, it communicates with some other nerves. Which nerves? So this is lateral cutaneous nerve. It will communicate with the radial nerve. Okay, branches, superficial branches of the radial nerve. Obviously, it has to be superficial for it to communicate because this is also cutaneous. So, superficial branches of radial nerve, posterior cutaneous nerve, palmar cutaneous branch of median nerve. Which other nerves are there? Everybody else it will communicate with. That's all. Okay. So, mention some branches of radial nerve, some branches of median nerve, etc., etc. Okay. But did you know, guys, if lateral cutaneous nerve is coming from musculocutaneous nerve. Okay, where is this medial cutaneous nerve coming from? Where is this posterior cutaneous nerve coming from? See, this is forearm. In forearm, you have lateral cutaneous nerve. Similarly, you have medial cutaneous nerve, and then you have a posterior cutaneous nerve also in forearm. Okay, do you know from where they are coming? Interestingly, it is very easy. Medial cutaneous nerve is coming from medial cord and posterior is coming from radial. Okay. Another half mark if you have to get in the exam, you have to write the heading as termination. Okay, termination of musculocutaneous nerve, and you have to say that it terminates by continuing as the lateral cutaneous nerve of the forearm. This is very important. This is the termination. Actually, this nerve, this lateral cutaneous nerve, see, it goes from elbow to wrist, including the ball of the thumb. This much you have to write. This is the termination of the musculocutaneous nerve. It becomes lateral cutaneous nerve of the forearm. And it goes from elbow to wrist, including the ball of thumb. Okay. Termination over. Now, one extra point you have to know here when they ask branch. No, when you're telling the muscular branches, one more thing you can write is what do these muscles do. That time you will know if this muscle is this nerve is injured, right? So they all flex only. The coracobrachialis, it will flex the arm. It will flex the arm. Coracobrachialis will what will it do? It will flex the arm. Biceps brachii and brachialis will flex the forearm. Okay. Biceps brachii and brachialis will flex the forearm, remember. And biceps brachii also can help in supination when the forearm is flexed. Okay, it's a strong supinator when the forearm is flexed. Everything is flex, flex, flex. Remember, angle is reducing. Okay, so now let us look at this part of the question. Explain why the motor distribution of musculocutaneous nerve is affected in Erb's palsy. So first, what we will do, we will look at what happens if musculocutaneous nerve is injured And then we will look at what happens in Erb's palsy. Okay. Erb's palsy is a lesion higher up. Okay. So not just musculocutaneous nerve, lot of other nerves are affected. So obviously musculocutaneous nerve also is affected. But first we will understand what happens if musculocutaneous nerve is injured. So what will happen if this nerve gets injured? You cannot flex, obviously, right? Especially the forearm, you cannot flex. Now, if the nerve gets injured here, everything will get affected. The muscles, right? And this sensation, lateral cutaneous nerve part, that sensation also will go away. But only if here, if it is cut, only the sensation will go away. Muscles will still be fine. This is clear, right? Now, they have asked in the exam about Erb's palsy, right? This is the next thing. 1 mark they have asked. Erb's palsy, what happens? Why musculocutaneous nerve muscles are affected? Okay, that's what they have asked. So, what is Erb's palsy? So, now coming to Erb's palsy, first of all, Erb's point is there. What is Erb's point? Somewhere here. Okay, that's what they've shown. So basically here is the region of the upper trunk of the brachial plexus and it is called Erb's point. So here you can see it is getting C5, C6, right? This point, what happens when the baby is getting delivered, they pull the baby and the neck gets pulled in such a way that the baby will become like this, This is a policeman tip. The fingers are outward, see, because C5, C6 are affected. Okay, remember C7 is not affected, C5, C6 are affected. So this is Erb's palsy. Remember Erb's paralysis, C5, C6 are affected. So here, what happens? Musculocutaneous nerve is getting 3 things, C5, C6 and C7. Right? So musculocutaneous nerve also is affected. So which and all muscles are affected? Biceps brachii, this you know. Brachialis muscle also affected. Apart from this, many other muscles are affected because it's not just musculocutaneous nerve which is affected. Many other nerves from brachial plexus are affected. So you have the deltoid affected, supraspinatus affected, infraspinatus is affected, brachioradialis, supinator, extensor carpi, radialis longus also is affected. But coracobrachialis is not there in this list. Why? Because C5, C6 are affected, C7 is not affected, C7 also little supply is there for coracobrachialis, so coracobrachialis got saved. Okay. Explain why the motor distribution of the musculocutaneous nerve is affected in Erb's palsy. So just for 1 mark. So you will say Erb's palsy is where the C5, C6 roots are affected, right? And as the musculocutaneous nerve receives the roots of musculocutaneous nerve is C5, C6, C7. Hence, the motor distribution of musculocutaneous nerve is affected. Okay. In this, which are the muscles affected? Brachialis and biceps brachii are affected. Biceps brachii and brachialis are affected. Coracobrachialis is not affected because it also has the C7 which is supplying it. Okay, so coracobrachialis saved. These two are affected, right? But in Erb's palsy, lot of other muscles are also affected. If you have more time, you can write. Okay.